Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
And good afternoon once again. May is Melanoma Awareness Month. Today is Melanoma Monday. And knowing what changes on your skin might be putting you at risk for at least some skin cancers is critical to prevention. So joining us now to explain why, we welcome Hope Merz. She is a nurse practitioner at the Advanced Cosmetic Surgery and Laser Center. Hope, how much of your practice is sort of dedicating to this kind of education?
Hi, Liz. Yeah, a lot of my practice. So I specialize in dermatology, procedural, and medical. And a lot of my practice is identifying and being able to properly treat and remove suspicious lesions.
Now, if you have something that looks suspicious, what's the first thing you should do?
Of course, it's important to have a head-to-toe exam from your dermatology expert once per year. But if you have a lesion that you're not sure how long it's been there, do you have a wound that seems like it's not healing? Do you have a mole that has changed or doesn't look like your other moles? You want to have someone look at it right away because skin cancer is very preventable and treatable in early stages.
So you gave us some great photos of just things that maybe on the surface we might think are just okay, but we want to have you talk us through a few of those and tell me what happens when some of these sort of go below the skin. Like this is a squamous cell carcinoma. What is that?
So squamous cell carcinoma is within the skin, is created by UV radiation mutations, and it can be just on the very surface of the skin or it can go deeper. So depending on the depth, that kind of relays what sort of treatment we need to perform. In the early stages, you can actually just treat those with a cream at home, or else we might have. Also on the screen, there's a dysplastic nevus. That's a very common occurrence, and I wanted to show that picture because you can see that it doesn't necessarily look like a really scary mole. It's just a slightly two-toned, and that ended up having severe dysplasia when we biopsied it, but we were able to excise it, and then no further treatment was needed.
And these are all things that, as long as they don't sort of go below the surface, then you don't have that risk of something getting into your bloodstream, correct?
Correct. So one good thing about skin cancer is you can typically see it. And when you see something that's suspicious or just makes you say, hey, that hasn't been there, let me get that checked. That's an easy way to be able to be sure that you're keeping your skin safe this year.
Well, we want to put up a phone number because there's probably nothing more important than people having someone that they can call to have something like this looked at. And if I do come in and look at you and you do need to remove it, are any of those insurance covered, or what do we know about that?
Yes, so we do a lot of cosmetic removals, but we also do lesions that are pre-malignant and malignant, and those typically are covered by insurance, at least partially. You can also use your HSA or FSA card as well.
Yeah, that's really important. 513-351-3223. Hope Merz, nurse practitioner, Advanced Cosmetic Surgery and Laser Center. We love talking to you. Thanks for being here today.
All right. Thanks, Liz.